What in the world is going on with our Wendy Williams? How did we go from someone like this, totally interactive with the audience, smiling, happy, really with it, to this, looking very down, very flat in the affect, not very excited? The media has been very unkind to her. They are remarking about her bulging eyes, her alcohol consumption. Maybe she's responsible for all these problems. But in all likelihood, she's not. Hi, I'm Dr. Messina, and we're going to look into the history of Wendy Williams and try to figure out really what's been going on to cause this extreme change in this once very happy and vivacious person. Wendy Williams was one of my favorite daytime talk show hosts. I found her to be very natural, someone who might actually live next door. Very approachable and friendly, very witty. And then, in 2017, during a Halloween show, she came out dressed as the Statue of Liberty. As we see in this clip, she looks great. Then all of a sudden, looks very upset. Clearly, something is frightening her. She feels that something is very wrong. And then she passes out completely. She came back later in that show and said, "I'm very sorry. The heat from the costume got to me," which was probably true and probably a combination of the heavy, thick costume plus the studio lighting. A few weeks later, she came out and said she was diagnosed with Graves' disease. Graves' disease is a form of hyperthyroidism, where your thyroid gland produces too much thyroid hormone. Now, when we look at what Graves' disease can do to you, it can give you an increased heart rate. It could give you arrhythmias such as atrial fibrillation. If you don't treat it, you could get a thickening of the heart and a decrease in cardiac function, leading to congestive heart failure. Patients tend to develop a tremor. They feel fatigue. Sometimes they feel very fidgety. They might get personality changes and mood changes. They also get an exquisite sensitivity to heat. So now let's look at that clip again. She felt something wrong. I bet you she was feeling some kind of cardiac palpitation. She had a look of somebody who had impending doom. And then she passed out and complained about the heat in particular. That's the first thing. In time, she started to exhibit other signs of hyperthyroidism with Graves' disease. Weight loss, mood changes, personality changes. She started to develop a goiter, in other words, a enlargement of the thyroid gland. She also developed exophthalmos or thyroid eye disease, which is a bulging of the eyes, and it occurs in approximately 30% of the individuals affected by Graves' disease. And it is not a benign condition. The bulging of the eyes leads to pain, double vision. The eyes become dry and gritty. Sometimes they become very red. And if it involves your optic nerve, you could actually go blind. There are drugs for thyroid eye disease, but they have some severe side effects. And they only resolve about 2 to 3 millimeters of the eye bulge. So it's not going to be a big effect. During the TV documentary, she talked about this thickening of the skin on her feet. That, again, is Graves' dermatitis. And for some reason, the skin, in particular on the tops of the feet, becomes reddened and very thick. It's not really treatable. She's developed that too. So she does have severe Graves' disease. Now, there are treatments for Graves' disease. Usually ablation of the thyroid gland or surgical removal of the gland. It'll take away the excess hormone, but unfortunately, it won't correct the exophthalmos or thyroid eye disease. People at risk for developing Graves, it basically could affect anybody. But if you're female and under 40, you're slightly more at risk. If you have an autoimmune disease already, such as rheumatoid arthritis or insulin-dependent diabetes, you're more at risk. If you have a family member with Graves' disease, then you're also at increased risk. Now, sometimes severe stress could cause it to occur. Usually you do have to have some familial history for that. There are some complications to having Graves' disease. It has to be treated. But like I said earlier, You can get some cardiac complications and get a thickening and loss of cardiac function and get congestive heart failure. You could get arrhythmias like atrial fibrillation. There's an increased risk of having a miscarriage and brittle bones, especially if untreated. So we have a problem right there. This Graves' disease probably caused a lot of these initial problems with Wendy. Now, unfortunately, if that wasn't enough, she was recently diagnosed with a form of dementia called the frontal-temporal lobe dementia. And as we see in this diagram, the frontal lobe, which is responsible for your personality, your behavior, the expressions on your face, and the temporal lobe, which is involved in speech and some motor skills and understanding and interpretation of words. When you're suffering from this frontal-temporal dementia, if you look at a CAT scan, you're going to see the brain is atrophying. In other words, the brain cells are starting to die off or get smaller. Therefore, you start to lose brain function. When you lose function in the frontal area, you often get a personality change or a mood shift change. As we see, a once extremely happy and laughing person now seems to be a very somber person. She doesn't have that big wide grin anymore. And it's not only because she's sad and she's upset that she doesn't have her show. It's also part of this dementia. When dealing with the temporal lobe atrophy, we're dealing with the part of the brain involved in speech, some motion, and interpretation of language. Therefore, these people might have difficulty in remembering and understanding the meaning of words. They might lose the ability to interpret spoken and written language. They'll start to be very hesitant in their speaking and speak in very short sentences, as we kind of saw in that documentary. It seems like they're being terse, but they're not. They're having real trouble in understanding and remembering different things. Sometimes they have trouble articulating words, and it might look like ALS, but it's not. Unfortunately, the cause of the frontal-temporal lobe dementia is unknown, and there's no real treatment for it. It tends to progress. So I think the best we could do is wish her well. Let's hope that she gets another shot. And let's hope that her disease doesn't progress any further and she can find some means of stability. And remember, if you do like these videos, my topics include general medical topics, topics like this that are trending, and aesthetics. Remember, click subscribe, hit the bell to be alerted to the future videos, and I'll see you next time.